Thank you, Dr. Hamad. Thank you, Prof. Aldohayan, Dr. Hassan, and all the panelists. This is our great honor to launch our new Dextile Anatomical Mesh in this great gathering, the third Saudi Laparoscopic Society Conference. Again, my name is Hany Hassan. I'm a marketing lead for hernia repair solution Medtronic company. My presentation actually will take around less than 15 minutes, including 2 minutes video at the end of my presentation. So there is a story for each Medtronic products, and our Dextile Anatomical Mesh story started from 4 years back. We designed and validated the Dextile Anatomical Mesh in close collaboration with the healthcare professionals worldwide. This means that we interviewed over 100 surgeons. We involved over 50 surgeons across the 7 cadaver labs to test the products. We collaborated with the 18 regions in US, Western Europe, Greater China, Japan, Australia, New Zealand, and EMEA countries. And alhamdulillah, Saudi Arabia was one of these countries validated the Dextile Anatomical Mesh through the past 4 years. Also, we involved the nurses throughout the R&D process. This is our complete lab inguinal hernia portfolio, and the objective to have Dextile Anatomical Mesh is provide an easy use mesh for minimal invasive laparoscopy as well as the robotic inguinal hernia repair. Moving forward to the features and the unique features of Dextile Anatomical Mesh is, first of all, the sealed edge all around the mesh, which is give you maintaining the mesh shape and easy of handling. It's a macroporous mesh, more than 1 millimeter pore size. So it gives you excellent tissue integration and transparency. Exclusive textile structures, easy handling, and it is a 3D anatomical shape for wide coverage for the MPO or the inguinal region. So now you have a mesh covering the 3 types of inguinal hernia repair. We have direct, indirect, and femoral. Also, we have 3 sizes, left and 3 sizes right, to ensure the right size for the your patients. Moreover, the mesh made from polypropylene monofilament textile and had the ML or green orientation mark, which is stand for medial line, which is for the surgeons to orient him that this part should be on the medial line. And there is an inferior edge unsealed just to comply with the anatomy in the retropubic space. Finally, this is inferior flap, which is comply with the anatomical structure here, which is the iliac vessel and spermatic cord structures. Again, the pore side is macroporous, more than 1 millimeter. It's particularly 1.1 by 1.6. And as you see, the pore side is hexagonal shape. So whatever tension you have, the pore sides will remain open. It's a heavy weight, more than 90 grams per meter square, and is sterilized by ethylene oxide, single use, and not for re-sterilization. Why Dextile? Actually, there is 2 needs. There is need for the surgeon and need for the patient, which is easy of use mesh, less recurrence, less infection, and less pain. So by using the Dextile Anatomical Mesh, you have the right feature to support the optimal clinical outcomes, which is the easy of use coming from the sealed edges from the mesh itself, the memory shape, which is the combination between the heavyweight polypropylene and macroporosity, which is more than 1 millimeter, and you have a 3D anatomical shape with wide coverage for the 3 types of hernia, and finally the macroporosity, which will give you transparency and easy visualization behind the mesh to see what is the structures behind before fixation, or even you can you cannot, or you can use fixation or even leave it without fixation. This is the available sizes we have. We have medium size 13 by 9 right and left. We have a large size 15 by 10 right and left as well. And finally, we have the extra large 16 by 12 right and left. Finally, the contraindications here is don't force the mesh through the trocar. So just grab it from the inferior edge we have and push it gently through the trocar. Don't roll it. And recommendation, don't cut the mesh. To conclude my presentation before the video, the Dextile anatomical mesh is designed specially for minimally invasive inguinal hernia repair, TAPP technique, or trans-abdominal pre-peritoneal or total extra-peritoneal, or even robotic TAPP surgical approach. The Dextile anatomical mesh enhances inguinal hernia repair with its new anatomical shape, wide medial and inferior coverage, transparency, and easy intraoperative handling. The result is an optimal polypropylene solution that you can depend on for positive patient outcomes. Now I'm just gonna change the screen to another to the video for 2 minutes, and then I will done my part here. Is it clear for all or not?
It's clear, Hani. Yeah, you
the
can go ahead.
The anatomical mesh fits in easy surgical workflow. First, orient yourself to the mesh by ensuring the ML marking is readable and placed towards the medial plane of the patient's body. Dissect to obtain a critical view of the myopectoneal orifice. Ensure you can visualize critical landmarks prior to mesh insertion. Grasp the medial edge of the mesh and gently introduce it through the trocar using a 10mm trocar for medium and large mesh sizes and an 11mm trocar for the extra large mesh size. Allow the mesh to unfold. The unique structural design enables the mesh to maintain its shape after trocar passage. Confirm positioning by ensuring the medial edge overlaps the patient's midline. Gently direct the inferior flap laterally to align with the anatomy, and guide the unsealed inferior edge down to the retropubic space. Finish the procedure per the tap or tip technique used. Make sure that during space deflation, the lateral and inferior edges stay flat against the abdominal wall and do not roll up as the inguinal space desiflates. Surgeons everywhere are discovering the difference. Enhanced design, full inguinal anatomy coverage, Dextile anatomical mesh.
Thank you very much. I have done my part, and for any questions, I'm ready either through the question and answer box or chat box. So thank you very much. Back to you, Dr. Hamad.
Thank you, Hani. I think at the end of the session, we will play your video because I think you shared the PowerPoint, not the video. The video was not being able to watch.
Okay, so by the end we can...
at the end of the session of the day, we will go ahead with again, if you don't mind. So I'm opening now the floor for any questions, if anybody wanted to share with the voices. If not, we will go ahead with our last and the third part of the session. If there are...
The Dextile anatomical mesh fits in easily with your surgical workflow. First, orient yourself to the mesh by ensuring the ML marking is readable and placed towards the medial plane of the patient's body. Dissect to obtain a critical view of the myopectoneal orifice. Ensure you can visualize critical landmarks prior to mesh insertion. Grasp the medial edge of the mesh and gently introduce it through the trocar using a 10mm trocar for medium and large mesh sizes and an 11mm trocar for the extra large mesh size. Allow the mesh to unfold. The unique structural design enables the mesh to maintain its shape after trocar passage. Confirm positioning by ensuring the medial edge overlaps the patient's midline. Gently direct the inferior flap laterally to align with the anatomy, and guide the unsealed inferior edge down to the retropubic space. Finish the procedure per the tap or tip technique used. Make sure that during space deflation, the lateral and inferior edges stay flat against the abdominal wall and do not roll up as the inguinal space desinflates. Surgeons everywhere are discovering the difference. Enhanced design, full inguinal anatomy coverage, Dextile Anatomical Mesh.
Thank you, Dr. Hussam and Dr. Hamad and Prof. Aldohayan as well for this, for allowing me to show you the video of Dextile. Thank you very much, and this is all I have.
Thank you.